Good morning. Thank you so much for joining us today. My name is Carrie McClellan, and I am the Outreach Manager for Elder Health. And I am also on the San Diego Fall Prevention Task Force. So today we're going to be talking about fall prevention and how you can keep your loved ones safe. We are gearing up for fall prevention awareness, and that always starts the first day of fall every year. So we're looking at how we can make sure that people are aware of the different tips that you can help prevent falls from happening. So let's get started. So are falls really a problem? Yes, they are. So the number of seniors who fall each year is 1 in 4, and that number actually was just updated by the Center for Disease Control, the CDC. Used to be 1 in 3 seniors fall each year, but it doesn't necessarily mean that we are reducing the number of falls that are taking place, but it's because there are more seniors who are turning age 65 and over. So the 1 in 4 seniors is because the population is increasing, so there are more people that are accounted for, which makes the number change there. We do also know that that is 1 in 4 seniors over the age of 65, but once somebody turns 85, the number of seniors who fall each year 85 and over is 1 in 2. So as our loved ones are aging, they are becoming more at risk for a fall. So here in San Diego in 2013, there's some information about how many seniors were treated and discharged from emergency departments, over 17,000. And then hospital stays, 7,400 hospitalizations with at least 1 night stay were as a result from a fall. There were 230 plus deaths that were associated with falls. So we know that there are people who are falling, and we're really wanting to make sure that we're keeping our loved ones safe and preventing those falls from taking place. Some of those indirect costs that are involved is a loss of independence and a decreased quality of life. And we'll go through those different pieces as well, but they all play an impact on our loved ones and making sure that we are preventing those falls from taking place. So why do seniors fall more than others? There are some different risk factor categories that we're going to be covering this morning: balance and mobility, medical conditions and different medications, vision, so our visual abilities, and the environment. So how does the environment impact our fall risk? So first we'll talk about the balance system. So balance is a major player in how we can prevent falls. So we are looking at 3 different pieces of information that is input into our brain. So visually, what we are seeing through our eyes. So if we are able to see what's in front of us, tables and chairs, different things in the room that we're going through, to make sure that we're able to see those different things. Our vision is very important with our balance. And then touch. So proprioception is the term for touch and how we see ourselves in space, and that's really how our feet feel the ground. So when our loved ones might be using a cane or a walker, that gives them a better sense of touch because they have more points that are touching the ground that are sending messages to their brain. And then our inner ear, that has an important role as well. So we often hear of vertigo or Meniere's disease, different conditions that are affecting our inner ear. That is associated with balance and increasing our risk of having a fall. So why is this important? Because our brain is interpreting all of the messages from our vision and from our touch and we are putting that into how we are reacting. So your loved one, if they have their balance is a little bit off, or they are dealing with some vertigo, they might not be able to react as quickly when they are tripping, and they may not be able to catch themselves if they do have a fall. So we look at quick reaction time, and of course strength and flexibility are very important, and those are all impacted from our system of making sure that we are keeping our balance in line. So what can we do? The number one thing that our loved ones can do to reduce a fall is to exercise. And this doesn't mean we have to go and run marathons. It doesn't mean that we are needing to do extreme exercise. But what the suggested amount is 30 minutes of exercise most days of the week, including strength and balance activities. So it could be that your loved one enjoys walking, which is wonderful. So encourage them to keep walking and moving about and making sure that they are increasing their mobility. And we also want to increase the flexibility and the strength. That all plays an impact on the balance in our core. So maybe they're doing some walking, but they're also doing some different exercises and building up their balance and core. So some of the medical risk factors that we are aware of, so different medical conditions that can impact our risk for a fall. So diabetes is one, for instance, that if you have diabetes or if your loved one does, they may have difficulty with feeling the ground as well, because they might have some numbness or some tingling or pain, often referred to as neuropathy. So that's very common in people who do have diabetes. And the important thing to keep in mind is that we just want to make sure that the diabetes is being managed, that they are regulating their blood sugars, and that they're keeping that stabilized. Arthritis is another factor. For people who are dealing with arthritis, they might have a lot of pain. It might take them longer to get up in the morning to feel like they're ready to start their day. So you might see that they're moving a little bit slower, and that's okay. We're wanting them to ease into the day, but it might be something that is slowing them down, and that is making them feel like they shouldn't be doing as much activity. Osteoporosis, so that alone is something that is causing people to, when they have a fall, they might have an injury that takes place because their bones are more brittle with osteoporosis. So keeping that in mind and making sure that you're talking to your loved one's physician about that, and keeping an eye on all of those different aspects. People who have had a stroke, even a minor stroke, sometimes they can have some one-sided weakness, whether it's the right side or left side of their body. And that, of course, can cause an impact on their risk for a fall, because they might not have the balance and stability as they used to, with having both sides of their body working in the same way. So they may use an assisted device, such as a cane or a walker, to get around, and that is keeping them more stable and more balanced after that stroke. Vitamin D deficiency. So we live in San Diego, so we have a lot of sun, right? But even with that amount of sun that we might be getting, we are finding that doctors are checking our vitamin D levels to make sure that our bodies have enough in them. So they might encourage or recommend our loved ones to take a supplement of vitamin D to make sure that their levels are staying at the appropriate point, so that can help to reduce their risk of having a fall. And dementia, so any cognitive impairment or any type of memory impairment is going to be an impact for our loved ones. So if they have some confusion, or if they are distracted or not able to focus as much, they might not be able to recognize when they're going into a room and there's a step that's taking place there. So making sure that there are different eye triggers that can keep them from falling. So maybe it's putting a certain strip that's going from one step to the next. It's a different color, so they're having that contrast. But dementia is definitely a risk factor. Blood pressure, that could impact somebody if they have lower blood pressure, if they are getting up in the middle of the night to use the restroom. Oftentimes we want to make sure that somebody who does have low blood pressure is allowing their body to adjust to a sitting up position and then in a standing position. So if they have low blood pressure, it might be that they just need to think about getting up a little bit more and doing it on a step-by-step basis versus just jumping out of bed and heading to the restroom as they used to. So different medications that we will be talking about, cardiac medications, so any that are relating to heart diseases, sedatives, of course, because those are meant to be used as sleep aids, and then antidepressants. So those different combinations and different medications can impact somebody's risk for being a fall risk. So these are just some examples of different sleep aids that are commonly used. So we see Tylenol, and Tylenol, of course, is over the counter, but it can affect somebody's body, and everybody tolerates medications differently. So if your loved one is taking any sleep aids to help them get to sleep or stay asleep, just making sure that they are appropriate levels of the medication, talking to their doctor and making sure that they're having that included in their list. Because somebody who is taking a sleep aid and is getting up in the middle of the night might be at more risk for a fall, because sleep aids are intended to be used when you're sleeping and to help you stay in that position, not when you're awake. So they might be causing some dizziness or some confusion if you are getting up while the sleep aid is in your body. Valerian root, while that might be a natural option, that can also affect somebody. So everybody has a different tolerance for different medications, even if they're over the counter. So we want to make sure that we're taking a look at all of the different sleep aids. Allergy medications can play a role as well. So somebody who might be taking Benadryl or NyQuil, if they have certain allergies, those can often make us feel drowsy. So we want to make sure that that is something that if our loved ones are taking those, that they are being careful and that they're not driving, they're not getting up and doing certain exercises when they are taking some of these medications. So some of the side effects that we've already a little bit touched on, but dizziness is a major factor that can be a side effect from a lot of different medications. And again, everybody's bodies react differently. Syncope, that is when somebody has fainting spells. Visual disturbances, if somebody is seeing different things or their eyesight isn't working as well when they are taking certain medications. Sedation or drowsiness. And then, of course, confusion. So if your loved one is mentioning any of these different side effects, or even if they're not knowing that it might be related to a certain medication, ask them if they have any of these side effects. That might be something that needs to be discussed with their physician so that you're making sure that they are taking the appropriate doses and that their side effects are limited. So what can you do? So it's really important to have your loved one's medications reviewed by a doctor or by a pharmacist. So you don't always have to have it done by a doctor, although it's encouraged because different physicians are prescribing different medications, and you want to make sure that everybody is aware of the complete list of medications your loved one is taking. But a pharmacist can also review the medications and make sure that there aren't any that would be counteracting the other. So sometimes there might be two medications that are prescribed for the same condition. So taking a look at that, is that something that the doctor is recommending, or is that going to cause more trouble? Of course, if somebody has their blood pressure is needing to be managed, maybe taking two medications is going to lower it too much. So we want to make sure that all of those different aspects are being looked at and evaluated. Of course, as our loved ones are aging, their bodies are changing, and maybe the doses of the medications need to be adjusted as time goes on. So if your physician for the loved one is prescribing a certain medication now, that needs to be reevaluated next year and again in another year, or more frequently than that if there are changes, because they're wanting to make sure that if those doses need to be adjusted or lowered, that your loved ones are taking the lowest dose necessary. And of course, making sure that the medications are being taken correctly. If you're concerned about that for your loved one, there are different medication dispensers that can be utilized. They have different reminders that are available so that your loved one is knowing when it is time to take those medications, so they're not taking too much and they're not taking too little, but taking the right amount at the right time. So it's again important to make sure that the list of medications that you are keeping for your loved one is a complete list. So it's keeping in account the prescription medications, any over-the-counter medications, as well as herbal supplements or vitamins. Sometimes if we are having our loved ones taking a vitamin that might be recommended by a friend or by a physician, they might not know that there's another medication that you're taking that could counteract that or could cause some other side effects. So taking the complete list and making sure that that is staying up to date with when there are changes, so that you can have your doctor or pharmacist take a look at that list as it changes. And for new medications, make sure to ask your loved one's doctor, does it interact with any of their current medications? Or is this dose the appropriate one that they should be taking? Sometimes we have just a short amount of time with the doctor, so just making sure that we're asking all of those questions so that we don't leave feeling like, oh, we should have asked that, and if they maybe did have an interaction, that they would be telling us. But the doctor's time is limited as well, so it's important that we're advocating and that we're asking those questions. There are different monitors available for your loved one if they are recommending to have the heart rate or blood pressure or blood sugar monitored at home. There are often devices that can be used at home. Of course, there are professionals that can come and do that as well. But most often, if it's going to be on a routine basis, your loved one would be able to do that in their home setting, and there might be a way to communicate that with their doctor, the results of that then. So again, it's important to make sure that you're reporting any side effects. That might be something that your loved one isn't going to tell you about. So if you're asking questions, make sure that you're asking how they're feeling, or after a new medication has been started, do they feel a little funny, or is there anything that they're noticing that is a change? Because they might not know that it's related to a medication, so they might not want to tell you about it and worry you. So just asking those questions, because it might be something as simple as adjusting the dosage and having the physician take a look at it. Of course, remembering that any alcohol can impact medications and take effect there. So if your loved one does have an alcoholic beverage on a daily basis, making sure that they're communicating that with their doctor so that they're aware, so that they know that if somebody is taking a certain medication, that they might still be continuing to have an alcoholic beverage as well. And how is that working together? So making sure to talk to their doctor or pharmacist about any concerns that you might have. Here are some questions that could be helpful in what to ask your loved one's doctor. So we do encourage the doctors to assess your loved one's risk for a fall, and that could be done by a test that they're watching them get up from a chair and walk across the room and come back, or it could be a simple questionnaire asking them about certain things and finding out more about their day-to-day to assess their risk for having a fall. So that's something you can always ask your loved one's physician about when you're going to an appointment, and they might have something in place. Can any medications contribute to a fall? So again, just making sure that we're asking those questions and not assuming that the doctor is going to tell us those things. And if the doctor recommends your loved one taking any supplements, maybe they are recommending the vitamin D or B12 vitamin or something else, just wanting to make sure that that they are having those questions asked by the physician. We also talked about exercise being the #1 thing that your loved one can do to help prevent a fall, but it's important to ask their doctor what type of exercise is the most appropriate. So it might not be getting up and doing an exercise class. Maybe it's going to be in a seated position, or maybe it's going to be walking that would be better and it's not going to be as strenuous. So just trying to find out what is appropriate for your loved one and making sure that you're always checking with their doctor. And then, of course, are there any risks from the medical conditions that they might have? Learning about the different medical conditions that your loved one has, like diabetes, or if they do have cognitive impairment or some form of dementia, making sure that you're fully understanding the progression of those and how that can impact your loved one. And their risk for a fall. Over time, you might see that your loved one is having some changes, and so just being aware of what to expect in the progression of those conditions. And we'll talk about what referrals might be beneficial. So it might be that your loved one could benefit from seeing a specialist, and maybe it's to a neurologist if they're having something that the physician is recommending to have a specialist take a look at more in depth. And we'll also talk about different exercise as well as physical therapists and occupational therapists that can be referred by your physician as well. So the physical therapist can be ordered by your loved one's doctor. There usually does require an order from your doctor for having a physical therapist evaluation so that they can bill the insurance, but not always. Sometimes if you're going to pay out of pocket, that might be another option. But a physical therapist can be really helpful in evaluating the balance and strength of your loved one and giving certain recommendations on exercises that your loved one can do. Maybe they're only visiting once or twice a week, but there's different things that they would recommend your loved one doing every day of the week to help build that strength and build that endurance. They can also give suggestions or make an evaluation about different assistive devices that could help your loved one. So maybe it's time that your loved one is using a cane or a walker. Recognizing the different types of canes and walkers are important as well, because there might be some that would work better than others. For example, there are a number of different canes. Some have one single prong that reaches the ground. Others might have a 4-prong or a 3-prong. So it'll be important to have somebody really evaluate and assess what would be most beneficial to your loved one. In addition, if somebody does have arthritis, they might have more difficulty holding on to a cane that has a more narrowed handle. So there are other flatter options that are easier for somebody to grip if they do have arthritis in their hands. So keep that in mind. And then there are a number of different walkers that are available. Some have 4 wheels with a seat. Others might have 2 just front wheels. So just making sure that a professional is evaluating your loved one's need and giving those recommendations can help your loved one feel like they can still get out and do things, but they will be safer. An occupational therapist is another good recommendation that can help with home safety. They can assess different aspects of the home, and they look at a lot of what activities of daily living your loved one might be needing some different tips and tricks for. So meal preparation, is there a way that they can continue to prep their own meals in a safer manner? or bathing. Are there different ways that they can bathe a little bit safer? Maybe it's using a handheld grab bar or a safety bar to help them get in and out of the bath okay. Or maybe it's using a bench that is seated where you can sit on one side of the bathtub and swivel your legs into the bathtub, and that way your loved one can still take a shower, maybe using a handheld shower head, but that they're doing it a little bit safer if they do have to get in and out of a bathtub. It can be slippery. And then we're also looking at, the different devices and other tools. Occupational therapists look at it from a different standpoint as well. So here are some examples. So this is a picture of a reacher, and a reacher can be very helpful if you're wanting to try and grab something that might be on the floor. So for your loved ones who might be driving and they of course are in a stopped position, but maybe they need to pick up something that they've dropped on the floor, they can do that. It can go in between the seats very easily. It's narrow. Or at home, in the kitchen or in the living room, making sure that they are able to reach and grab things with the reacher might be helpful instead of them bending down. There are different step stools that can be more of a broad base, so that if your loved one is going up onto a step stool and reaching something that's higher, although they might ask for your help with that too, which is good, but if they're doing it on their own, to make sure that the base of the step stool is wider and maybe that there's a handle on the step stool so that they can do that safer. The portable seat lift can go over a toilet seat so that you're having that riser and that they're able to push up off of it a little bit easier and not having to go down to such a low level. So vision is very important as well. We encourage your loved one to have an annual vision exam by an eye doctor. We know that vision changes slowly over time, so wanting to make sure that we're looking at how your loved one's vision is changing, and are they having a need for different prescription glasses? Maybe they have had a change recently and it's causing them to have a little bit more difficulty. So having that annual exam is going to make sure that whatever they are using for eyeglass wear, that it is appropriate for them. Additional light is also important. So as we age, we need more light to see. So instead of having a dim light to read by, maybe they need to have a more higher wattage light bulb that is able to see a little bit better. Also, when your loved ones are getting up in the night to use the restroom, making sure that the lighting along their pathway is bright enough for them to see everything and to have a better way of getting there. So it's probably not a surprise that most falls happen in the home. So we're wanting to look at the environment and how your loved one is getting around the home, and some of those different aspects can play a role. So lighting, we talked about. Throw rugs. So if your loved one likes having throw rugs in the home because they're pretty, making sure that they're tacked down. There's special tape that can be used so that the corners are not curling, so that even if they are using a cane or a walker, that they are not having the walker or the cane kind of trip up on the rug as well. So keeping that in mind. And of course, the shower, the bathing is often slippery, so we're wanting to make sure that we're taking a look at the bathroom as well. This is just a good checklist to go through, so making sure that your loved one has frequently used items within reach, making sure that they have non-slip rubber mats on the shower or tub floor, that we install grab bars or safety bars next to the tub and toilet, making sure that there's clear pathways through the floors. There are different modifications that can be made and organizations locally that help with that. Elder Help is one, that we have volunteers who help with installing safety bars or making minor modifications of seniors' homes. So taking a look at what's locally available. So if your loved one has a fear of falling, that can definitely impact them having another fall. So if your loved one has had one fall, they might be more at risk for having another one. So we want to address the psychological impact of having a fall and being fearful of having another one. Maybe they are looking down more when they're walking. They're not looking ahead. They might be holding their body more tense, which isn't allowing them to walk more confidently and more gracefully. So they might be more at risk for a fall. So of course, the important part is to improve balance, stay active, and ask for help or use assisted devices when needed. Mental activity is very important. So we talked about dementia or cognitive impairment, making sure that our loved ones do have focus and that they are not as distracted when doing activities. That can be helpful. Encourage things like bridge or different brain games to exercise the brain. Those are all important things to increase the mental activity and mental abilities to stay focused and be less distracted. Shoes. So it's important to use the appropriate shoes, not the high heels, but shoes that have a very low, narrow sole so that, again, your loved one is able to feel the ground beneath them and have a better sense of what's underneath them. So just to recap, exercise, of course, is the #1 thing that you can do. Making your home safer is important. Talk to their doctor, have that vision exam, a medication review, ask about any referrals to a specialist. Managing the well-being of your loved one overall, making sure they're eating well, drinking lots of water, and if they are having a fear of falling, making sure you're talking to them about that. There are local resources available, such as Feeling Fit Clubs, 35 classes throughout San Diego County. So if you're interested in finding out more about that, the healthierlivingsd.org website is a good one that has the list of all of the different locations for the classes. Your loved one can also watch the different classes on TV, or they can get a free DVD with a stretch band sent to them if they're living within San Diego County. So take a look at that website. Some state or national resources. Stop Falls, California will tell you all the different resources within California. And then Center for Disease Control is available for national resources. So again, thank you so much for your time. And if you have any other questions, please contact Elder Help. Our contact information is there, or the San Diego Fall Prevention.org website. Thank you so much.